Nailed it.
Hey, future nurse practitioners. My name's Dr. Kneeling, and you've made it to Nailed It. This is going to be your go-to prep for the PMHNP-BC that's offered by the ANCC. Today, I really wanted to take a chance to dive into some test-taking strategies that are actually going to make a difference. I want you to have less stress, better outcomes, and I want you to walk into that test feeling like you belong there. Because let's be real, you do. Let's make the test format a little bit more clear. So there are going to be 175 total questions. 25 of those are what's called pilot questions. These are ungraded little experiments by the ANCC. There's no way to tell which of these questions are not being graded, so you just need to give every question your full attention. At the beginning, you're going to have some allotted time in which you can do the tutorial, and I strongly recommend that you do that. As far as the test goes, you're going to have 3.5 hours total, and that's plenty if you pace yourself. And we're going to talk about how to do that too. The questions cover domains like scientific foundations, advanced practice, diagnosis and treatment, and ethical and legal principles. So the whole exam itself is actually very comprehensive. You can pause the video here to see some examples of the content in each domain. This is all based off of the ANCC test blueprint, which you can find a link to at the bottom of the video and in the description. The blueprint will contain more details that includes the breakdown of numbers of questions and a little bit more details on the content. The night before your test, and please hear me when I say this, the night before your test, it's all about preserving your mental bandwidth. Get good sleep, eat food that your body is used to, and hydrate. Don't try any new supplements. Don't try to mega dose on your caffeine. Just prepare yourself. I strongly believe in the no studying 24 hours before the exam. At that point, I find that I'm too stressed to actually retain anything that I'm studying. Also, knowing the route to the testing center, and in fact, driving it the day before the test, it can reduce your nerves significantly. Even if you just pull up a map application and you just take a look at what the street looks like and where you can park, that's going to be very helpful. I encourage you to think of this like you've been prepping for a marathon. All of your training is done, and now you're getting ready to run the big race. Okay. Let's say you made it all the way to test day. There's a few key things that you're going to want to know about testing with Prometric, which is who offers this exam. First and foremost, they won't even let you check in unless you have a unexpired government issued ID that has your photo and your signature. This most commonly looks like a driver's license, a state issued ID if you don't drive, or a passport. So once you have got those things together, you're going to head to the first security desk where they're going to check it once. And then after you've cleared the first security desk and locked away your belongings, you're going to get checked in. For me, that meant showing my arms, lifting up my pant legs to show my ankles, turning my pockets inside out, being swept with a metal detector, and having my photo taken. They do offer noise canceling headphones, and they were at my little workstation desk when I got there, but I have kind of a big head and they didn't really offer good coverage, so I could hear the AC and I could hear the door opening and closing. So you are allowed, and I encourage you to bring soft foam earplugs or the silicone ones like swimmers use. They can't have any wires, but if you need to block out the noise of the other test takers, that is an A+ recommendation. You can also bring a bottle of still water with you, but it has to be in a clear bottle with no labels and a lid, and you're going to have to present it to them for their inspection, and then you can have that at your desk. I didn't opt to bring a drink, but the option is there for you. My test time was 7:30, but the day before I went to the testing center, I received an email telling me to show up at 6:45, I think it was. Yeah, it was 6:45 because I showed up 15 minutes early at 6:30, as a type A personality does. And it took them 40 minutes to get me checked in. So if you have an early testing time, don't cut it too close. Just show up however early you need to show up, because it takes quite a while for them to check in all of the people before you and then get to you. The room was a little chilly, so I would encourage you to dress in layers if you get cold easily. As I headed in the door, they gave me 2 whiteboards, which in my circumstance were just pink pieces of paper that had been laminated, and they gave me 2 markers. At my location, they told me that I could not erase those whiteboards or else I would fail the boards. One of the phrases that another lady in check-in was using was erase the board and wreck your boards. So they also told us about those whiteboards that you weren't allowed to start writing on them until the first exam question appeared on your screen. The test tutorial doesn't count against your time, so use it to get comfortable. Click around, practice scrolling. In PMHNP prep groups, I commonly see questions asked about what features are included in the actual exam situation. You can flag questions, and the interface will show you which questions you have flagged, which ones you have viewed, which ones you have answered, and allow you to navigate back to them without any difficulty. So if I am all the way on question 140 something and I need to go back and look at question 3 again, I can scroll right up and click on 3. You don't have to flip back through all of the questions. You can also, in the question prompt, you can highlight words or phrases that you think are going to help you narrow down your answers. And in the answer selections, you do have the ability to strike through answers you don't think are correct by right-clicking on them. If you plan to do a quick brain dump, like writing out your test day priorities or acronyms, be aware of your test center policies. Like I said, our location, we were not permitted to brain dump until the first question. Honestly, at that point, I was so nervous and overwhelmed that I didn't have any mental resources to brain dump. The test tutorial doesn't count against your time, so use it to get comfortable. I want you guys to realize that flagging questions is not a sign of failure. It's a really smart strategy. If something feels off, take your best guess, flag it, and circle back later. You're conserving energy and precious time. It's not the same as giving up. This pacing graph helps you avoid 2 big traps: spending too much time early on and then panicking at the end. So most guides say budget about 45 to 60 seconds per question, and I have found that 60 seconds is a perfectly good cutoff. If you use 60 seconds for every single question, it's still going to give you buffer time to reflect on your questions, to review your answers, or even just to manage your anxiety, which we'll talk about in a little bit. If you find that you are, reaching outside of those 60 seconds, flag the question. Give it your best guess and move on. When you get to that buffer time, when you have time to go back, you can go back and look at all of your flagged questions. So I guess it comes down to aim to be accomplishing about 55 questions or more per hour. That way, when you get down to 30 minutes left of your test, you're going to find that you have 10 or fewer questions, and then you get to use about 20 minutes to review your flag questions, take a breather, review your answers in general, or just get ready to celebrate that you're going to pass your exam. It's not about speed, it's about consistent momentum throughout the exam. This is a pretty big tip. Read smart, not fast. A lot of people fall into the trap of skimming the questions for words that they recognize, and they end up not reflecting on what's actually being asked. What's on this slide is pure gold. Keywords like first, best, most appropriate, or least likely, they're not interchangeable. They're signaling exactly what the question is asking you for. If you see first, think about your priorities, including patient safety or assessment. If it says best, weigh the options like a real clinician. This is specifically asking you for the most correct answer. If you see not or accept, throw it in reverse. It's the complete opposite logic. You might see this in a question like, all of the following medications are FDA approved to treat generalized anxiety disorder, except, and if you miss that except keyword, you're most likely going to get the answer completely wrong. These aren't filler words. They're the keys to unlocking the question. So this slide maps questions to the nursing process, and that's completely intentional. If they're asking about assessments and your answer is an intervention, you're not going to have a good time. Stick with what they're asking for. It's like a matching game. You can pause this video here to see how this applies to the test questions a little bit more. But ultimately, there are no trick questions. There are no gotcha questions. And always, always, always remember safety first. This slide has almost no content on it, and yet it will probably save you more than a handful of points. So let's talk about logicking our way through the test. These are not hard and fast rules, keep that in mind, but more like guidelines to give you the highest chance of success, especially if you don't know the answer for sure. For example, if two answers are complete opposites, like increased dose and decreased dose, there's a good chance that one of them is correct. Eliminate absolutes like always or never unless you're 100% sure that is the correct answer. And anything that's half right, still wrong. You should also pick answers that engage you directly with the case. Speak directly to your patients, speak directly to other providers. Don't refer out if you can do an intervention that's still within your scope. This might look something like, a patient comes into the outpatient mental health clinic because they feel weird after drinking an unknown substance. The patient's vitals are currently stable. The possible answers might include something like immediate transfer of care to the emergency room versus performing a urine drug screening. The urine drug screening is still in your scope and the patient isn't currently emergent. So pick the option that keeps you involved in the patient's care and doesn't shirk the responsibility onto someone else. And finally, look for answers that are collaborative. That's going to be a huge word throughout the entire exam. Collaborative and all of its synonyms. Choose answers that are collaborative, patient-centered, and aligned with evidence-based care. Your testing instincts are only going to help you if they've been trained. After enough practice, your brain is going to start recognizing these patterns, even if you're not consciously realizing it. If something feels right, and it fits the test logic, trust it. If your gut's coming from panic, though, just take a pause, take a breath. That's not the same thing. Whether you're a rusher, a dweller, or a panic clicker, self-awareness is going to be your superpower. Rushers, force yourself to reread the question. Dwellers, practice best guessing and coming back when you have more time. Panic clickers, use your breathing tool and re-engage your logic. These qualities aren't flaws, they're parts of you that can be planned for and accommodated. I cannot stress this enough. Mind your own business. In the year leading up to my test, I heard so many rumors, and a bunch more after that negated the first set of rumors. Not every comment thread is gospel. In the PMHNP test prep groups, someone will often post a question from one of the many, many question banks, and the comments will still contain every possible answer, rationales that are both accurate and false, and arguments galore. If it's not in the test blueprint or listed in the ANCC resources, don't make it a priority. Study smart, do not study social. Leave the fear-mongering behind you and let the people who think that they know best think that way while you quietly succeed. There are good reviews out there, but I didn't find any of them to be comprehensive enough or to make me walk into the test feeling confident enough. I purchased 3 common, highly expensive reviews, and in fact, that's why this channel was born. I want to bring you free or very low-cost exam prep. Just like socioeconomic status shouldn't play into the type of mental health care that someone receives, how much you can afford to pay should never be a factor in how well prepared you are for a national exam. I'm going to be releasing videos on all of the domains, difficult concepts, topics suggested by viewers, and anything I think has a high likelihood of appearing on this exam. I plan to try to keep content as concise as possible while ensuring that you get high yield nuggets that you're going to need to nail this exam. Regarding question banks, for my learning style, Pocket Prep helped me prepare well for the exam. The questions are not, and I repeat, not formatted the same way they are on the exam. However, the questions pull content from knowledge contained in all of the ANCC listed resources for the exam, and it gives detailed rationales. If you're working to understand the material, this is what I found to be the most comprehensive. You can answer 30 to 50 questions for free, or pay $15 to $20 per month, or $119 per year for access to all 1,200 review questions. And different testing modes come with that package as well. I have a 20% off link for Pocket Prep near the end of the video and in the description below. Again, Pocket Prep for me was about understanding and mastering content. If you're wanting to prepare yourself for how the questions are formatted, then the closest replication is the ANA Practice IQ Question Bank. It costs $149 or $110 if you're a member of the ANA. You can also receive discounts for being a member of other professional organizations like the APNA, but it's not as big of a discount as the ANA discount. Again, this is the best match for how questions will be asked on the actual exam. Third option, if you're wanting to practice the test logic and the matching strategies on possible answers that we discussed a little bit earlier in the video, you can use the practice test in the back of the ANA's Psychiatric-Mental Health Nurse Practitioner Review and Resource Manual. The 4th edition is currently what's out. It's known commonly as the Purple Book. Its cost varies from $10 to about $75 based on the format, like electronic or paperback. Sometimes places have ongoing discounts. I got my own PDF of it for $10. And if the book, if you order an actual book, if it's new or used. It does serve to note that this book was published in 2017, and it does show its age in certain entries. The ANA released a 5th edition recently, but had to retract it and refund some purchasers due to the high amount of typographical errors. And there was also a ton of inaccurate information. At the time of this video, the ANA has not re-released the corrected 5th edition. But again, this is a good source to practice your answer eliminating strategies on. Bearing those 3 opinions in mind, and as this channel develops, I do intend to release free and extremely low-cost question banks that combine all of the above: the content, the question format, realistic answers. So if you have some time to wait, you might save some money. Let's talk about managing your anxiety before the test, during the test, after the test, whenever you need it. I'm going to show you some anxiety-reducing breath work, and I want you to appreciate that it's not just fluff. It's actually neurobiology. It's not, a moment of Zen where we all hold hands. Inhaling actually stimulates the sympathetic nervous system, and exhaling activates the parasympathetic system. By exhaling longer than you inhale, for example, 3 seconds in, 6 seconds out, you're going to tap into your vagus nerve. That slows your heart rate, calms your brain. I used this right before I started my test, and honestly, right before I started recording for this video. Let's talk tips about practicing for the exam. First of all, don't just blast through the question banks. Review the rationales that are supplied to you. That's going to be a huge help for you, because sometimes even if you can't remember the exact answer, you can remember why other answers aren't the correct answer. Flag any questions that you get wrong, and especially flag those that you get right because you guessed. Track your weak areas. That's where the magic happens. And if you're feeling overwhelmed by 3.5 hours or 175 questions, ramp up into it. If the goal is to answer 55 questions in 60 minutes, try setting a timer for just 30 minutes and practicing 25 to 30 questions. As you get more comfortable, you're going to be able to extend your time. It's unrealistic to expect some learners to be ready to tackle the entire certification exam on day 1 of studying. Give yourself some grace and give yourself some time to prepare. So here's the big recap. Know your pacing. Decode the keywords. Match the question to its answer. Use your test logic. Collaborate, collaborate, collaborate. Always with your patient, with the scenario, and with your own brain. That's how you're going to walk in ready. Finally, if this video helped you, please don't keep it to yourself. Subscribe, drop your top worry in the comments, and hit like so that we can keep growing this community. You can also grab that pocket prep discount, 20% off with my link below. I just want to reassure you, we're not just prepping, we're collaborating to get you certified. Let's nail it.